My name is Nalima Sitati Munene. I'm the Executive Director of ACER. ACER Inc. is the African Career Education and Resources Inc. We're an issue-based organization, and our mission is to work to close the inequity gaps that exist within the African heritage community. ACER was established in 2008, and it was established by community members, and it was established from a recognition that we had a significant African immigrant community that was growing in this area. So the genesis of the organization was really to connect people to the resources and information and make sure that our communities were able to have what they needed to be able to be successful in their new home in Minnesota. So right now, our big main buckets of work are health equity. Health equity is an issue that our communities have grappled with and continue to grapple with, for a long time. People's housing determines what the health outcome is going to be. People's level of education determines what the health outcome is going to be. And so health equity is a big part of our work. Our other bucket of work is housing justice. We do a lot of tenant organizing, and most of the tenants we organize with happen to be low wealth tenants of color, addressing issues of housing insecurity, advocating for tenants' rights policies, and also advocating for policies that continue to advance the production of affordable housing and just overall promoting housing security in our state. Our other main bucket of work is economic development. We want, immigrants move to this country and they're starting from scratch. And so our goal is to help people in our communities to start creating, not just, working from paycheck to paycheck, but really encouraging them to start building, wealth and accumulating wealth in our community. Finally, we have the civic engagement and democracy bucket of work. And so we believe that in order for communities to be successful, they have to engage in the civic engagement process. And that includes, teaching our communities how to participate in the local governments, going to city council meetings, going to community meetings, being at the table, when decisions are being made. We also do a lot of work around the census, every 10 years and making sure that our communities are counted accurately. Right now, we're engaged, in the redistricting work, making sure that our communities are aware that there's a redistricting and mapping, but we're also advocating that there's no gerrymandering, that the maps are drawn fairly. The COVID pandemic really shifted the work that we do. ACER was one of the COVID community connectors contracted by Minnesota Department of Health. And so we have been working to expand in the beginning testing, within the Black communities, and right now have been working a lot on vaccinations. The other piece of work we did was around, testing, just expanding testing and making sure that people had access to testing in our community. And that included making sure that we were addressing the barriers that existed to testing. In the beginning, we realized that there were a lot of people who didn't have access to transportation to the testing sites. Or the other issue people were facing was just registering to be tested was so difficult. My hope for our community is that we're not just addressing the COVID issue, because it is not the issue. The issue is the systemic discrimination, the systemic racism that has always existed. But now that it has been exposed, my hope is that we will continue to have this conversation, that the systems will not back out, and retreat and go back to business as usual. And my hope for our communities is that now that we know we have the power and have the solutions, I don't want us to back away. I think we've taken a huge step forward. As my hope for our communities will continue to push forward and to push hard and to push further so that we can get to where we need to be.